Support for this show, Politics Done Right, comes from politicsdoneright.com, publishers of How to Make America Utopia, Take Away the Economy from Those Who Rigged It, As I See It, Class Warfare, The Only Resort to Right-Wing Doom, It's Worth It, How to Talk to Your Right-Wing Relatives, Friends, and Neighbors, and other books written by Egberto, Willies. Welcome to Politics Done Right. My name is Egberto, Willies, your host. Good morning, Houston. Good morning, Harris County. Good morning to the great state of Texas. Good morning to the United States of America. Good morning to the entire world receiving our signals via the magic of El Internet, created by whom again? We the people. We the people. Now controlled by the billionaires, but something that we must and will mitigate. How are my peeps doing? Well, folks, we promised you that we would be here full show today if you guys allowed it. And guess what? You guys allowed it. You are the best in the world. May I say that again? You are the best in the world. But without further ado, let's pass it to the geniuses in the studio. We have El Señor Jack Van Bever and Mayana.
Absolutely the best in the world. This is KPFT Houston. And we cannot help but be grateful and happy that everybody is here and listening.
Right on, Mayana. That was good.
How you doing, Jack?
I'm good. How are you, Egberto?
Oh, I'm under the weather. So if you see a lack of excitement somewhat, it's because the body hurts. But we are going to have a show, brother. It must go on. Democracy.
We were just saying you can't hear it. You can't hear it when you do your introduction. I was like, wow, Jack is like, he sounds great.
Well, Howard was out at the tower yesterday, so maybe some things got fixed.
There we go. I love to hear that. Anyway, what's up, Jack? What's the word of the day?
Okay, today we stand at what may be the most consequential moment in American history since the Civil War, a moment in which working people face not only economic neglect, but overt attacks on their rights to health care, food assistance, and democratic participation. At the same time, we'll travel abroad to the Republic of Korea, where a U.S. professor has uncovered how a humane universal single-payer system outperforms our for-profit-driven model, offering lessons that Democrats and working Americans cannot afford to ignore. This is about defending workers, reclaiming democracy, and learning from a nation that proves a better way is possible. And to that I say, progressive Democrats have a decision to make to damn the torpedoes full speed ahead.
That is so
championing, right. And championing workers' rights, calling out the culprits of corporate power that have taken over government functioning and their puppet, their useful idiot, Donald J. Trump. Pound away at single-payer health care and all for all, and restore SNAP benefits, women's reproductive rights, and fix our Supreme Court of the United States and end Citizens United and defund ICE. Now is the time for bravery and moral accountability. This must be done. It just must be done.
Now is the time for bravery. You're so right. And in fact, the piece that I'm going to do from Brother Bernie Sanders that he wrote in for the Common Dreams is going to cover just that. So, I mean, let's talk about that. Anything else you want to add before we get started, Mayana?
No, this is just a monumental time. I hope people are going out to vote, tomorrow. And right now it's today's Tuesday, right? Oh, yeah. Tuesday. Yeah. Sorry. Yeah. And today, and it's just a monumental time for us. So let's make it happen.
Yeah, thank you very much for that, Mayana. And I want to start. I'm glad Mayana brought up voting because, like I said, I'm a little bit under the weather, and I should have been speaking about voting, and I didn't start. I didn't even put it in the newsletter. Thank you for Mayana for that. Mayana is absolutely right. We have got to, we talk about wanting to take our democracy, and we want things the way we want them, and we want. It's not enough to want in a democracy. You have to participate in a democracy. There on my website, egbertowillies.com,
In my bio, there's a thing that I say all of the times, and and a phrase that I love, and it goes as follows: political involvement should be a requirement for citizenship. And that is not something that is enforced. I'm not asking that it's been enforced or anything like that. But as we complain about our government, we also have to take responsibility for our government. You know, when you hear Republicans talk about government and conservatives talk about government, they don't even say government. They say government, government, government. They want you to believe that government is this something out there. They forget, and by the way, they need you to believe that government is some third thing out there that is likely to do you harm. But it isn't. Government is whatever you make it. Donald Trump only has the power that we cede to Donald Trump. And every politician only has the power that we cede to them. We can always remove them. And people say, oh, but they have the military. No, they don't. The military is us as well. There is a symbiotic relationship with all entities of government and society. A symbiotic relationship between these entities. And again, government is us. We, the people, is real. Today is the day that you go out and change government. You can go out there and ensure that the Constitution isn't amended to give rich people inordinate power. I want you to think about that. We are trying to put within our, and I don't have it in front of me right now, but we are, first of all, let me just tell you, I went ahead and I voted no on every single constitutional amendment. And let me tell you why I did that. Everything that's good in that seems to be good in those propositions, it's something that can be done under current law right now. And let me tell you what I don't know. I don't know how the meat of each constitutional proposition will act, has a death clause in there that modify things we weren't sure of. And because of that, I said the Texas Constitution is fine the way it is. But there are provisions in that that they want people to vote on that pretty much says we are going to prohibit you from taxing rich people's wealth. People. The rich people's wealth by itself was ill-gotten. Most of the wealthy, their wealth was ill-gotten. I repeat, their wealth was ill-gotten. And now for us to put within the Constitution that you cannot tax the wealth of the wealthy, that is ridiculous. So we can't have that. Now, so let's be clear. We want to be able to do and control our own government. We cannot put constitutional amendments that tie our hands so that a politician can say, I know you voted and wanted me to do this, but the Constitution says I cannot. We have to use our heads. So when it comes to voting, you've got to go out there and you have to take your country. And you take your country by voting, but not just voting, but being an educated voter. When I went into that booth, I knew exactly what I was going to do. I knew I would be voting against every single amendment to the Constitution, every single proposition. I knew which particular candidate I was choosing for city council at large. And there was one other person that I had to vote for that I also knew who I was voting for. If you haven't voted yet, it is important that you go out there and vote. We cannot talk about what Donald Trump is doing to our society if we are not locally, and this doesn't only talk about Texas, this is all over the country. Today is a big voting day all over the country. You cannot talk about what these guys are doing to you when you're sitting at home. In fact, sitting at home gave us this second instantiation of Trump, and the pain that the people are feeling at large is because of Trump. So let's go to the shutdown. One of the reasons that Democrats should not assist Republicans in opening the government, because remember, the government is closed because of Republican policy. Democrats must not help Republicans open the government without actually getting those subsidies overturned. If they absolutely want the government open, they can do it. They can blow up the filibuster. They can blow the filibuster and they can open the government if they want to. But remember what comes after that. It means that when Democrats or progressives are in power, also there will be no filibuster to be concerned about. So again, that ball is in the hands of Republicans. They can decide to be humane and provide the subsidies so that Americans can have health insurance and not die, or they can go ahead and pass a filibuster, open the government, allow Americans who will lose their insurance to die, and we can then place the blame directly on them, because that is what they're asking for. And this is not inhumanity on the part of those not providing the filibuster-proof majority. This is all entirely on Republicans. When Marjorie Taylor Greene decided to jump onto the Democratic bandwagon saying that we must go ahead and support the subsidies, reality came home to her. A large percentage of her base is on Obamacare. A large percentage of her base is on Obamacare. But, we told Marjorie Taylor Greene when she was supporting the big, beautiful bill that took away money out of healthcare to give it to rich people, we told her that your constituents will pay the price. And they all said, no, it's not going to happen, etc. Well, on November 1st, 2 days ago, they all went to the exchange. Business people, farmers, and all these others went onto the exchanges, and many found out that without subsidies, their health care double, triple, sometimes quadruple. And that is where we're at today. Who can afford an extra $1,000 or extra $1,500 a month for health care? Nobody can, or very few people can. Very few of their constituents can. And that's where we are today. So I have a piece to run on healthcare from Dr. Theis. Dr. Theis I played this yesterday in my main program on our online program. I want you to listen to this interview I did with Dr. Theis over the weekend about what we should be aspiring for here in the United States of America. I want you to check this out, and then we'll take it on the other side. Welcome to another edition of Politics and Right. My name is Egberto, Willies, your host. Today I'm honored to have Dr. John Theis, a political science professor at a major college in Texas. We're going to be discussing healthcare. Specifically, we're going to discuss how healthcare is handled in a country that is humane towards its people relative to healthcare. And we're going to also talk about systems that harm. Dr. Theis, thank you so kindly for being here with us on Politics and Right.
Hey, my pleasure, Egberto.
Dr. Theis, tell us, first of all, as you know, in the United States, many progressives are fighting to have health care declared as a human right. It is hard to believe that a country that claims, many, specifically those on the right, that it is a country that believes in the sanctity of life, that this is a subject that isn't really close. Tell us a little bit about how healthcare is done in South Korea.
So, as you know, I'm over here. And what got me thinking about this topic? So, a couple of years ago, I was here as a Fulbright scholar, and I had to get a chest x-ray. And so I went and got the chest x-ray, and I thought, oh, this is going to cost me. And it cost me 20,000 won, $15
Wow.
for a chest x-ray. And then this year, I was working with a Korean university, and I had to get a physical and a drug test. So I went to a Korean hospital, got a full physical, drug test, all the blood work, everything. Cost me 55,000 won, which is about $40. So here I am, a foreigner coming to Korea, and the prices are like that. I mean, this is less than my deductible with insurance in the States. So I really started talking to people about the healthcare system here, and I was surprised. I have not had a single person tell me they didn't like the healthcare system here. They said, it's cheap. We can go to the doctor when we want. There's no lines. And in fact, that was the key. There's very few lines. When I went and got my x-ray, it took about 20 minutes. When I got my full physical, I was there at less than an hour. It's absolutely amazing to me how good healthcare here is. And so I started doing some research about it. And, South Korea is number one in the OECD on healthcare access. And it's rated the second most efficient healthcare system, according to Bloomberg News. So they're clearly doing something right. And so having grown up here, when I was growing up here in the 60s and 70s, there was no healthcare system at all. People just paid cash. In 1963, they created the ability to buy health insurance. And then in 1977, they made health insurance mandatory for all people. And anybody that worked at a company with 500 or more employees, the employer had to provide the health insurance. And they coupled that with a Medicare program for low-income people. But that was people buying health insurance, right? Mm-hmm. So it was still a market-based system. But in 2000, South Korea created the National Health Insurance Service. And that took all the private insurance companies and combined it into one insurance company. It consolidated all these insurance companies. And then they simply dispensed with the insurance company and went to a single payer system in 2004. And so South Korea currently spends about 8% of its GDP on healthcare. Now that's compared to the United States, where we spend about 18% on our healthcare. And the way they pay for it is 80% of the total dollars come from employee and employer contributions. So every employee pays 3.825%, and every employer pays 3.825%. So it's a total of 7.65% that they pay for their national health insurance program. And that covers 80% of the total costs. Then they have 14% or so as government subsidies, and then 6% from the tobacco surcharge to get to your 100% of the cost of healthcare. Now, some South Koreans also have private insurance. One thing that I noticed, South Korea is the plastic surgery capital of the world, right? Mm-hmm. So you would think with the government healthcare plan, those kinds of things would be non-existent. But in fact, they allow private competition. So there are all these plastic surgery clinics that are not covered under the healthcare plan, but people are free to go to it. I don't think a national health insurance program necessarily means you can't do other things, that you'll be that restricted. So there's still that kind of innovation, lots of people are able to pay for additional services that aren't covered, but basic healthcare is covered through the national insurance program. They have complete choice of hospital doctors. Like, I just looked through basically Naver, which is like a Google app here in Korea, and found the closest hospital and went to it for my physical. So there's no restrictions on that, which is much better than the US, where I have to always find in-network doctors and then get referrals to other in-network specialists, etc. So South Koreans tend to like it. I certainly find it preferable. I waited for both those appointments and the treatments combined. I spent less time than I typically spend for a checkup at my American doctor. And that's with a good insurance plan that's provided through my employer. And I have copays, right? Every time I go see the doctor in the United States. So that's basically how the system works. I think public opinion says they like it. The outcomes, the health outcomes, are really a lot better
than the United States.
Than the United States, yeah.
So let me ask you this.
Much lower mortality on things like cancer and diabetes than the United States, much lower women and infant mortality, much higher life expectancy than the United States. So
now, what you're saying sounds wonderful. And by the way, from a mathematical point of view, as an engineer, that's the only thing that I generally go by. Absolutism in math. And when you take a look at looking at the problem from a mathematical point of view, it is clear that if you have a single payer and you eliminate all the different types of waste that you get from having multiple CEOs, multiple CFOs, multiple advertising agencies that has to try to sell your insurance product, multiple databases that maintain things, risk assessment, which if there's one risk pool, there's no risk assessment that is really necessary at all. What is the drawback? What could somebody in the United States who learned about the South Korean system say is the drawback of such a system?
Well, so I've been looking at that, and there's several drawbacks. I mean, the costs are, because every year the government negotiates with doctors groups on prices. So doctors complain about the prices, and they occasionally go on strike. Okay, at least some doctors do. So what I've identified as some of the problems is they have one of the lowest number of doctors per capita of any OECD country. So places like Norway, Portugal, Denmark, which are also, by the way, single payer systems, have double the number of doctors that South Korea has. But interestingly enough, South Korea has 2.5 doctors per 1,000 population. The US only has 2.8. So we're not that far ahead of them on that. Another big issue is that South Korea, about half the population live in Seoul, the capital city. The other half are scattered throughout the rest of the country. So there's obviously a bias towards Seoul and to big urban areas. So rural areas are having problems with keeping hospitals open and doctors. But once again, that is not particularly different from the United States. Okay. The final thing, and this I think is different, is there's a really low proportion of nurses because the pay is low. I think that has to do with several reasons. One is primarily this was a patriarchy for a very long time, and women were nurses. Mm-hmm. So the nurses' pay is low. So they have a low ratio of nurses, much lower than the United States.
Now, that said, given that they are spending 8% of their GDP on health care, and we're spending about 18% of our GDP on healthcare. It seems like all those problems that you talk about, low pay for nurses, less doctor ratio, etc. Even though with that low doctor ratio, their outcomes are much better than the United States, and sometimes doctors going on strike. It seems like because we have our pot of healthcare money is so large that those would be small issues to mitigate if we convert it to a single payer system, and one that we don't allow drug companies to gouge us. I mean, many would say, well, a lot of innovation would go because a lot of profit would be gone. But isn't it true as well? And this is a compound question. Isn't it true as well that a lot of the research and development that we have is actually already paid for by the government and universities that are funded by the government?
Absolutely. I mean, that's the thing. And these drug companies sell the exact same drugs in Korea or Canada or Mexico at a fraction of the cost that they sell it to the United States. I mean, we could have our healthcare expenditure and still have a better healthcare system. Because we would negotiate prices, we would not pay incredibly high drug prices. And I think one thing you left out is profit for not-for-profit, for hospitals, for their stockholders. We don't need to do that. I mean, and doctors' offices who deal with 8, 10, 12 different insurance companies have to have a person just to deal with those different insurance companies, their regulations, their different paperwork. All that would be eliminated. I mean, I've always said, if you don't want to create a national healthcare system, if you're opposed to that, then let's give more choice. Let's let people decide if they can take their private health insurance their employer pays them. They can buy on the marketplace, or they can buy into Medicare. Your choice. And employers, you can buy into Medicare for your employees, or you can buy private health insurance. People who support the private health insurance market don't want to see that as an option. They don't want us to have more choice because they know what everybody's going to do. Everybody is going to end up, it might not be immediately, it might take 5 or 10 years or 15 years, but people will move to Medicare because it's cost efficient and its administrative costs are only, I think, about 3 or 4%.
Yeah. Mm-hmm.
Whereas private health insurance administrative costs are 30%.
Yeah, I mean, it is amazing. I think what we need are more stories of reality. What I love with the way you presented the system from South Korea is that you pointed out how it is funded. You pointed out how it is successful. You pointed out your personal experience with it. You pointed out what the current polling is about how the people feel about that particular healthcare system. You pointed out that it only takes 8% of GDP, and you pointed out that the outcomes are far better than the United States. And you have actually lived in it, used it, and saw its performance. It wasn't anecdotal. It is something that you saw.
Well, I think that's really important. I wish more Americans would travel outside the United States, beyond the resorts of Mexico or Jamaica, because there are lots of ways to deal with problems in your society. No one country has all the answers. So we can learn from other places. But what I see a lot in the United States is people saying we're the best reflexively, even when that isn't true, and saying we don't need to learn anything else from anybody else. And I think that's really dangerous. It leads to worse public policies, especially for those with the least power. People with power in our society, people with wealth, yeah, they live a different kind of life. But those of us that are middle class, working class, poor, those of us in the bottom 90%, we live a different life than that 1%. And things are not always how we would like them to be. And we can learn a lot from other countries and how they've dealt with some of these problems. We can learn things that they did well. We can also learn things that they did badly and that we should avoid.
Dr. John Theis, I think that's a perfect sentiment to end this discussion on. I think we've learned a lot. I think this is a message that needs to go through, especially now. And it is exactly what we intend to do. Thank you so kindly for once again having been on Politics Done Right.
Hey, it's my pleasure, Egberto. I'll come on anytime.
All right, folks, I hope you enjoyed that. There's a lot of work to do there. Let's go ahead and I think Sandy's waiting to come on. Sandy, you have a few words that you want to say.
Hey, good morning, Egberto. It's an interesting discussion, and I think right on the money, man. Right on the money. It's different when you travel and you see the other perspectives. Myself, I've had the misfortune to get to a doctor in other countries when it was necessary while traveling, and it's a whole different experience. We can learn quite a bit. I just wanted to pop on to say thank you to your audience, everybody listening. We went over our goal yesterday afternoon. Our $175,000 goal was exceeded, and that was done on the power of the renewed sustaining memberships for November. So for those of you that didn't make a pledge this drive, we're still taking pledges for the drive. We will till Sunday. However, it's only under the condition that you want to already contribute to a successful drive. We have additional expenses that have crept up in the last couple of months involving our transmitter, which are continuing to be costly. Yesterday, we made another attempt and came up with basically the same result. The condition of our HD signal didn't magically improve. So we're still working with the manufacturer, and of course, in doing so, spending a great deal of money trying to restore the HD broadcast capability. But again, to all that did contribute, thank you very much. This was done in 2 weeks and 5 days this time. 4 days this time, which is the fastest we've accomplished a goal of this magnitude. In fact, this is the highest goal that we had set since coming back to broadcasting Caroline Street. And I'm very grateful to all those that continue to hang in there and fund KPFT and make it a reality into 2026, and I hope well beyond. And Egberto, I want to thank you for your diligence and hard work during the drive, as well as Jack and Mayanna and, of course, Howard in the studio for making sure that all of this works every morning so seamlessly. Folks, if you want to contribute, you know the number, 713-526-5738, option 1, or better yet, our website, kpft.org. So thank you, Egberto, and that's all I got.
Thank you,
Sandy. I won't interrupt the program any further.
Congratulations on a successful drive all around. And again, that is because we do have, in fact, good people. So thank you very much.
Yes, we have a good team put together on all around. Listeners, people behind the mic, people behind the board, and those just keeping up with our building. So thanks to all. It's a wonderful thing seeing such a happy group of people doing what they love to do and succeeding at it. So
absolutely.
Good morning.
Absolutely.
Thank you.
Thank you very much, Sandy. Have a good one, my brother. All right, let's go to John from Minneapolis, and then I'll salute the people in the chat. Come on in, John.
You're clear, Sandy.
John, come on in, line number 1.
Yeah, I have worked in healthcare for many years. I was a respiratory care practitioner, and I have to say that the goals of the profit-seeking that goes on in our healthcare system inevitably clash with the goals of getting people well. And I think that, unfortunately, I would say about half of the medical profession really supports private health care because they like those profits for themselves. But they're even being replaced. They're being marginalized, and a rationing of care exists both in both systems, but I would say in our system even more than that system. And this has been discussed. I think Hillary Clinton, actually, when her husband was president, brought up the public option or healthcare for all, and was viciously attacked. So this has just gone on forever. But the bottom line, and as you said, you're a numbers person, we pay like almost 50% more than any other system in the industrialized world. And either they have a public system or they have a tightly controlled private system, like in Switzerland. And, you know, it's just been, it's terrible. I mean, essentially, these Republicans are saying your life is not as valuable as ours. And when do they even need health care? Most of them are millionaires. They can afford to pay right out of pocket.
Right.
And they ought to take a, look at that. These people just don't care about you.
And, that is one of
what did Scrooge say? Die and decrease the excess population. That's what they whisper among themselves. That's as much as they think you're replaceable. You're just a cog in a wheel. Your life is not worth anything, and yet they want to talk about the right to life. Actually, healthcare was part of the Declaration of Human Rights in the Charter of the United Nations. And guess who was the biggest proponent of that? Was Eleanor Roosevelt. And we need to live up to what was started at the end of World War II and what every other industrialized country and even some not so industrialized countries have actually done, which is to make that a reality. And that's all I have to say.
Appreciate your words,
John. Beyond the pale, but I can tell you, I live here in Minnesota. I do not see people coming down the freeway here from Winnipeg. It's only 5 hours away, racing, to get health care.
No, again, everybody, let me just say,
all of America. And I've never touched one Canadian patient in my whole 38 years of practice.
Thank you, John. Thank you, John. Now, let me just say, folks, here's the thing, right? And John's last statement is so true. You don't see anybody run into the United States and say we've got better health care. We don't. It's a figment of one's imagination to think that our health care is better when the outcomes around the world, which is what matters, the outcomes around the world. Welcome aboard, Lynette, Marjorie, Photomic. Welcome aboard, Uju. How you doing, Uju? Bobby K. MS Finbrit. Welcome aboard, Cynthia Gable, Peggy Blackwood. Thank you for being here. We also have, let me get to the top, John Davis, who just called in, Robert Murray, Jane B. in North Carolina, Harbinger, Wanda G., Larry, Donna Cuba, John A. Davis, Catherine Richardson, Lee Brown, Luz Rollin, Werner Golden, and so many more, including those that I missed in the beginning. Stephen Rosenwick, thank you for being here. Glenn Ryan, my brother out of Katy, Maine, Lumberjack Klesner Association. Thank you for being here, guys. We couldn't do this show without all of you. Let's go ahead and also in the other chat, salute Joe from Los Angeles, California. Uru Deemer says, I'm awoken but groggy. I know what you mean, but thank you for waking up for the show. Lady Bearcat from Austin. Harry Denson from Missouri City, Texas. Real is trying to talk between the lines here. He says, why does Egg, an insulting way he spelled it, keep saying he's an engineer? Did he quit being an engineer a long time ago? Let me answer it in two ways. Let me answer the last one first. Once an engineer, always an engineer. Did I ever quit being an engineer? I quit working as an engineer, doing software and other things, but I do a whole lot of that work in in broadcasting because I set up all my electronics. I do all the things that engineers do, both in electronically and otherwise. But I get the connotation from your question. I understand what you're trying to say subliminally. So let me give you the reason I point that out. In a society that still is disrespectful on the competence of some, I repeat, and I'm going to speak between the lines now. In a society that is disrespectful on the competency of some, when I'm calling numbers out, when I'm calling analysis out, when I am doing these different things, sometimes I cater that by prefixing my engineering bona fides. I also prefix this by letting it be known that I did work at NASA and letting it be known that I do have software on the station and let all those things. Those aren't things to brag about. Those are things for people like you, my brother, to say, no, I'm not just talking out the rear end. I know what I'm talking about. So your disparage notion subliminally, you understand what it's all about. Let's go to Johnny. Come on in, Johnny. Line 1. Johnny, you're on.
Oh,
Johnny. Yeah.
Like that. I want to thank you, Egberto. You saved me a whole bunch of time. I suspected that I was going to vote no on all these amendments, and then I heard you this morning say that you were going to do this, or that you did the same thing. So you saved me a bunch of time on the computer. The only thing I got to do now is when I go on the computer after your program is to look up races of people.
Right.
And I was telling Diana that as a default, I never, ever vote Republican. And by the way, if you ever see me leave a voting booth and you see I vote Republican, shoot me, because it means the Republicans have figured out the technology. So here's my question for you. Could you please clarify those 2 percentage numbers I heard? I heard an 8% by your guest, and I heard 30% by you. For the audience, for my sanity, could you please explain real quickly what each percentage refers to?
Sure.
And then I'll hang up.
Absolutely. The total cost of healthcare, let me go ahead and wait for that to go. The total cost of healthcare in Korea is 8% of their GDP. In other words, if you were to add up all the costs that makes up the GDP in South Korea, it is 8%. In other words, 8% of their economy goes into healthcare. In America, 18% of our healthcare goes into, the 18% of the GDP in America goes into healthcare or healthcare related. Now, the other numbers he mentioned was it's 7%. It's a 7-point-something% tax. Half of it paid by the worker, half of it paid by the employer to fund that. Comparing that to the United States, we have private insurance in the aggregate that you pay thousands of dollars to. In other words, if you buy a policy and you're paying $1,000 a month, you're paying $12,000 a year in healthcare. If you are at, let's say, in Korea, working for somebody and you're making $100,000, your total healthcare costs $3,000. So what I'm trying to say here is it's a lot more efficient. Why is it more efficient? Also, because to administer that healthcare in South Korea, it's similar to how we administer Medicare or Social Security. It only costs about 3%. Why? We don't have to give the people who sell you the policy. We don't have to pay that. We don't have to pay database costs. We don't have to pay executives. We don't have to pay shareholders. All of that is gone, completely gone when you have a single payer healthcare system. Now, the other number that the professor used was 30% overhead for private insurance. Obamacare restricted that to, I think it was 18%. But the reality is there are other back doors that insurance companies use. And when you add all those back doors in, the actual cost is easily beyond 30%. Because remember, your premiums are going into the pockets of the executives and the shareholders, all these folks are taking advantage of your premium. And one of the ways they profit more is delaying service or simply denying service. You have to get pre-authorization. They deny your pre-authorization. Even if the pre-authorization eventually goes through, by then you either get sicker, die earlier. I mean, what we have is a criminal. Our health insurance system is a criminal enterprise. And anybody that thinks otherwise really should understand how the thing works. One of the things that we say all the time is education is the most important thing. And our government, through things like the Powell Memo, etc., has no desire, because they're paid off by the corporations, to have us be educated. And that's what we do here at these programs, tell you how things work. And you can always go and validate everything that is said here. Let's go to Bruce, line 1.
Hello.
Yeah, go ahead. Yeah, I can hear you, Bruce.
Hello. Yeah, I'm doing like the previous caller and voting no, going on your recommendation on the propositions. But isn't there one dealing with dementia?
Yes.
Can you tell me what's wrong with that one, or am I mistaken?
No, you're not mistaken. There is absolutely nothing within the Texas Constitution currently as written that prevent the government from investing in. Let's get that cleared. Yeah, there's nothing currently in the Texas Constitution that prevents the government from investing in anything with regards to health care. Let me tell you what I fear. I fear that that supporting that actually limits what funding they can provide. When I read it, I'm not sure. But what I do know is that we have the necessary resources within our laws that we can fund any kind of research, that we can fund universities to do any of those items. And that's why I said the only reason you'll have a Texas legislature try to amend the Constitution is to throw something in there to restrict us. Let's go to Jimmy, line 2.
You offer all that information about South Korea. We can learn from other countries. I was curious about the businesses that have less than 500 employees. I wonder what their requirements are, because that must cover a lot of people also. But also, today is the election day. We need everybody to get out and vote. I know it's on Proposition 3. The Chronicle had editorials on both sides of that issue yesterday, but the Chronicle is for that issue Proposition 3. And I read about Stephen Colbert last night. He was being honored by a bunch of wealthy people, and he got up there and said, "Give away your money. You don't need to hold millions of dollars. Give away your money to worthwhile causes." I really like that idea right there. And these people that have millions of dollars, they don't need to sit on that money. Put it to work on some other nonprofit organizations like colleges for scholarships or other worthy causes.
Thank you, Jimmy. You're absolutely right. Thank you very much for that. And by the way, the thing that gets me the most, however, with a lot of the wealth that many has accumulated, folks like Elon Musk and the others, it isn't wealth that they earned. They made it legally given our capitalist system, but they didn't earn it. But we here have a tendency to adore these guys and somehow believe they're special and that they've earned it. Remember, everything that they have is on your behest. Everything. Most of these people couldn't program a computer, bar none, but they own software companies. They couldn't. So you are the hired help that made them the money. And somehow they don't want to pay taxes on it. Now, we have to start. One of the papers that I wrote a long time ago, one that went viral, was Assert Your Worth. We are the worthy ones. We are the creators. Let's go to Bobby, line number 1. Come on in, Bobby.
Hi, good morning, Egberto.
Good morning, my brother. Talk to me.
I was curious. Would you say that we're living in an oligarchy at this point?
Yes. No ifs, buts, or
I
anything
agree
about it.
And I'm kind of shocked now that Trump is, in so many ways showing that he wants an authoritarian government, and the way he snuggles up to all the other dictators around the world. I don't see any Republican outrage. I don't see anybody saying, "Oh gosh, guys, I'm sorry, we didn't know he was going to be like this or this and that." I don't see it at all.
Well, what happens,
I was thinking to myself, like, man, maybe I just need to leave this country. And I was looking at, let's say, like New Zealand, and I decided to look at their healthcare. They have like a dual thing over there where, everybody gets, healthcare. So if you have a life-threatening emergency, you're just taken care of.
Yeah.
But if you have like an elective surgery, because of their system, it might take a month or two, maybe to get a hernia repaired or something. So they have the option where they can also buy their own insurance, so they can skip, that month's line if they want. But nobody over there works their whole lives, pays for their house, and then ends up going bankrupt because of a medical emergency. Because we're all going to end up.
Bobby, you're absolutely right. You're absolutely right, and it's even worse than that, right?
As much as we're taxed, and they just step on the people. It's like, how much are you going to use us up and take everything you can while enriching yourself? It's like, if we're a tribe and there's a big table of food, I forgot who said this, and you have, like you said, Elon Musk, Jeff Bezos, and one more guy having more than half of the rest of the country has. Those three guys own. Like, at some point, we have to stop this trickle-down economy. It's killing us. And, I mean, eventually it's going to get to Marie Antoinette level where the people are just tired of it.
Bobby, you're absolutely right, but I got to go because I have 3 more calls, and everybody, you're absolutely right. Thank you, sir. All right. Let's go to Joni. Come on in, Joni. Real quick for me, Joni.
Egberto.
Good morning, sis.
So one of the resources, a really great resource that's available to people on, I think, any election, but certainly on this one, I found a pamphlet from the League of Women Voters.
Yes,
and it gives the actual legalese language, what the bill what the amendment actually says. Then it gives a summary of what it means in layman's terms. And then it gives the best arguments for and the best arguments against. So, and you can probably find it online, but I found a pamphlet at the public library that has all that written down in it for this election.
Yeah, thank you for that, Joni. You're absolutely right. The League of Women Voters have all that information. Now, like I said, I read it, and there was nothing compelling for me. And again, that's a personal vote, right? There's nothing compelling for me to change the Constitution, given the current state of the legislature. Again, because of my level of trust with who's in office, there's nothing I want to change a Constitution that those guys have produced. You follow what I'm saying? Oh, okay. Joni's gone. Let's go to Augie. Augie, real quick for me, my brother.
Good morning. Yeah, I wanted to call yesterday and talk about the World Series, about how great the immigrants were on the Dodgers that won the game. Yamamoto, the Japanese guy, who, when he's interviewed, was talking in Japanese. The South American players that hit the home runs and scored a couple of those runs. But also today, when they're talking about voting, I'm glad you said vote no. And the guy in Minnesota talking about the Canadians not coming here. My first primary care doctor when I moved to Houston was a Canadian. Mm-hmm. And for 3 years complained about the HMOs. Finally, he decided to go back to Canada.
Yeah.
But before he left, he talked about how Canadian doctors are trained differently than Americans. Canadian doctors are trained to listen to the patient and talk to them. In America, the doctors are trained to do a lot of tests. And that's a big difference.
Yeah, I mean, they don't have that personal relationship with the patient, but I'm out of time. Augie, and I need to jump to Tag real quick. Thank you, brother. And thank you for all the support you gave during the fund drive. Let's go to Tag. Come on in, Tag.
Hi, Egberto, real quick.
Yes, sir.
Universal health care works because of economy of scale. And private health care doesn't work because of all these people that get them into the system and they have their fingers in the pockets of everybody taking out money. So I just wanted to throw that in.
Thank you very much for that, Tag. As usual, you always have something sensible to let us know. Anyway, folks, we are almost out of time. So let me throw it to Mayana in the studio and Jack in the studio.
Hey, I heard Bruce talk about Proposition 3. And I just wanted to say, because that had to do with like bail, we have to remember that a lot of people are being arrested and like spending years in jail, like years in jail for things that they didn't do. Doing anything against bail, I think he said yes or whatever, that would be like horrible. There's some people spending 3 years and more in jail, and they haven't even gotten a trial. So, I mean, that's just for over arresting people. But, you know, that is a definite no for me. And I just wanted to mention that.
Thank you for that, Mayana. Jack?
That's my point, too. You know, they're going to go after misdemeanor cases and hold them in jail and just support the prison industrial complex. And as far as the dementia deal, it's, you know, there's already a bunch of research being done on that. So looks like to me they're going to create a boondoggle and just have a crony get paid to do the research. So that's why I voted against that one.
And also on Proposition 3, there's already other things that are written in law about that or dealing with that or trying to get that done. So, you know, it doesn't need to be in the Texas Constitution.
Yeah, let me just say, and you know, it's something that the people, anything that comes out of this legislature to change the Constitution, you have to really read between the lines. And what gets me with a lot of folks who do the analyses, right, is that they don't do it within the context. Why did they feel the need to modify the Constitution to do things that can be done outside the realm of the Constitution? And the reason is this. If there is a change in leadership in Austin, they want to have the Constitution as a backstop. I want no changes to the Constitution to force these things on another administration. Anyway, I need to get out of here. Thank you so kindly, all of you. Thank you for giving us a very successful fund drive. Love you all. You can get the rest of the show at politicsdoneright.com/newsletter. politicsdoneright.com/newsletter. Email me directly at kpft@politicsdoneright.com. My name is Egberto Willies. This is Politics Done Right. And you guys know how I end this baby. I am what? Out.
Support for this show, Politics Done Right, comes from politicsdoneright.com, publishers of How to Make America Utopia, Take Away the Economy from Those Who Rigged It. As I See It, Class Warfare, The Only Resort to Right-Wing Doom. It's Worth It, How to Talk to Your Right-Wing Relatives, Friends, and Neighbors, and other books written by Egberto Willies.